Melanie.
Thank you. Well, when we're done today, we'll go on and we'll have these conversations in other parts of the country. But clearly, the work will have just started. So here's the question that I have for you. How do you all want to be, plan to be, engaged in this healthcare debate, in this healthcare fight going forward? Because there's a lot of work to be done. So I want to find out how you all want to participate. I'll start with the woman in the back in the green with the black trim.
Good afternoon. Sala Panapasa, Pacific Island demographer at the University of Michigan Institute for Social Research. As I'm listening to the comments, insights, I am here to represent the voices and the faces that do not appear on paper. Specifically, I'm referring to those the numerically small population segments of the population throughout the country. Native Hawaiian, Pacific Islanders, Asian Americans, Alaska Natives, Asian Americans, and subgroups within the broader racial and ethnic categories. As we try to understand what is the real problem, what are the issues, these are segments of the population that do not appear on the national reports, health reports that is informing the nation's policy. We are being reduced to a dot, a dash, and a star. And I am, as a demographer, this is a major, a serious data limitation that is preventing people like myself and the communities coming forward, being present, and understanding what is their base, what are the real issues, challenges, and problems that affect them. And so I would like to pledge that we improve our data collection and help and reporting efforts and systems. The national surveys do not do justice to the numerically small populations. And I would like to also add that there is a great need for targeted outreach and health literacy that is culturally appropriate and meaningful to achieving preventive care in chronic disease. The healthcare workforce should reflect the diversity of this nation. We need professionals who are connected, who understand, and can treat individuals as humans. We're not, there's more to care than just a prescription and being under, and an x-ray. We need to take a comprehensive approach, a healthcare approach, as opposed to just a clinical, medical approach. And lastly, to provide coverage options for small businesses. A large segment of these relatively small populations are involved in service industry and small business, landscaping, etc. And these small businesses cannot afford a decent health insurance. So thank you. These are my contributions, and I hope that the message of engaging and putting a face behind the dots, the dashes, and the asterisks in our national healthcare reports is made known. Thank you.
Well, thank you. You raised several really important issues. One, in terms of making sure that everyone is accounted for, and the data collection, and that goes to research and development, clinical trials, a whole range of issues. Also the issues of cultural competency and disparities within our healthcare system. I know this is a conversation that Congress has had. This is something that the President has spoken about for quite some time. And I think it also raises the question, going back to what I said, about making sure voices are heard in this debate to make sure those issues are on the table.